It's another day on the program Healthy Living. I'm Adesuwa Usa Uwagie. Do you know if your kidneys are working perfectly? Do you know if there's a problem? How would you know that there are problems or there is a problem with your kidney? Do you go to the hospital to check, to see if you're healthy? Aside your kidney, you can also, do a general checkup to see if you're okay. Sometimes we move about without really knowing if we're well or not. And then you hear that, oh, so-so person slumped and died, or so-so person slept and didn't wake up. We're always hearing one story or the other, and the next thing you hear people say is, hey, yeah, it's not my portion. Whose portion is it? If you do not go to the hospital, if you do not see a doctor, if you do not do thorough medical check, how would you know if you're well? Today we want to look at the kidney. What can affect the kidney? How can you manage it? Is there a cure for kidney problem? If there's no cure, then what are you going to do? What will you do? What are the things we shouldn't do to save our kidneys, and what are those things we should do to make our kidneys healthy? These and many more we're going to be looking at on the program today. And of course, you can call in. The number to call in is 052-290-573. But we'll let you know when we'll start receiving calls. And we're going to be talking to a nephrologist today on the program. She is Dr. Onajiti Okaka. Happy to have you on the program, Doc.
Thank you very much.
And you're looking good.
Thank you.
All right, the kidney. We know that is one of the vital organs in the body, very important. Please talk to us about the kidney first before we start talking about what can affect the kidney anyway.
Yes, we have two kidneys. Most of the time, most people born have two kidneys.
Okay.
I said most people because sometimes, because of some problem with development, it can be that a person is born with only one kidney or two kidneys that are fused together. So sometimes we can have such abnormalities and people are born with defective kidneys,
okay,
or a single kidney, or a kidney that is abnormally located such that when you do a scan, they may not find it at first, then they discover that one is somewhere else in the abdomen. Now, what do the kidneys do for us? We see that everyone pees. We pass urine. It is the kidneys that produce urine. And in the process of producing urine, the kidney excretes waste products and excretes excess salt and water. So, by our daily function, the cells in our bodies carry out their own activities and metabolism, and to result in the production of waste products. And these waste products need to be excreted, because if they are not, they will accumulate in our bodies and they will make us sick. Now, apart from that, the kidney also produces some important hormones. It produces the active form of vitamin D, which we need for healthy bones. It also produces a hormone called erythropoietin, which we need to produce blood. Therefore, when someone has kidney failure, begin to have problem with making urine, it starts swelling up because they cannot excrete excess water. They now have problems with their bones because vitamin D is not there. They have problem with blood. In fact, they need blood. And even after you give them other people's blood, doesn't stay long in their body because they are not able to generate theirs. Why? Because the hormone required for blood formation, the kidney is not producing. So we can see that the kidney does a lot for us. There are two small bean-shaped organs in our abdomen, but they are very important because when something goes wrong with the kidneys, then the other organs will not be safe for long. Now, what are the things we should do to help our kidneys? Number one, drink water, enough water. If you don't drink enough water, by that we say you are not well hydrated. Okay. It can result in the formation of kidney stones. Why? Because the urine you produce will be concentrated so that stones can easily form, and those stones can damage the kidneys and cause problem later. So just drinking enough water aids the kidney in its job. How do you know you have taken enough water in a day? When you go and pee, your urine won't be dark. Okay. If you have taken enough water, your urine is clear. But if you discover that maybe you traveled or something, you were so busy, you didn't take any water, or you are sick. So You have a bad taste in your mouth, you didn't feel like drinking water, you didn't drink. When you pee, you see the urine is concentrated, it's dark. That is not good. So it's good for us to learn the habit of drinking water. Water is the best beverage for our body.
Okay.
What else can we do to help our kidneys? We have to have a healthy lifestyle. For example, we don't want to be overweight or obese. We must make effort to make sure that we do not get so much weight. And if you have gained weight, work at it so that you can lose some, because the excess weight takes a toll also on the kidney. Then good exercise. What we mean by daily exercise, you have to inculcate it into your daily routine. When we say exercise, we don't want to go and do something extreme.
Okay.
What we usually recommend, we say 30 minutes of moderate exercise. Could be brisk walking. It could be going on a treadmill or cycling on a stationary bike. You will discover that by the time you do that, by 15 minutes, 20 minutes, you're already sweating. If you were never used to exercising before, what you can do, you can start gently, maybe do 10 minutes. As you get stronger, you can do 30 minutes. We say if you can do that daily, fine. If you can do it 5 times in a week, it's also okay. So exercise is good for the body, for anyone, for any age. It keeps your joints moving and it keeps you stronger and in good health. What other thing can we do? Cut down salt. Salt is not good.
Okay.
And all those spices we use, like Maggi and all those, they are salt as well. Because when you taste them, you see they are salty.
Doc, let's not call names of products now. Let's not do brand. But sorry about that, please.
Okay, so spices.
Okay,
So
spices.
let's be careful
and,
that we don't use too much salt. It's not healthy for the kidneys. And apart from that, when we take too much salt in our diet, it leads to hypertension. And hypertension, untreated hypertension, is one of the causes of kidney disease. Now, still talking about a healthy lifestyle, it's good for us to have at least yearly checks.
Okay.
Some people may need to have twice in a year health checks, depending on what problems they are already struggling with. And what do we mean by that? We don't have to wait to be sick before you have a health check. The goal is preventive care. That means you want to catch anything that is developing in the body early so that you can handle it on time. And that is why we do certain things. For example, we ask women to examine their breasts. Do that daily, because we want to be sure that you are used to your breast and then you can pick any lump that is there early enough. We say once you are 40, do a mammogram. If you have in your family somebody who's had breast cancer before, do the mammogram earlier, maybe in your 30s. The reason is preventive. So when we say health check, it's preventive. At least check your blood pressure at least once every 6 months. If you have a family history of hypertension, even check it more often. Why? You want to know if the blood pressure is going up so that you can handle it on time. We say check your blood sugar, because some people have diabetes for many years without knowing. It is when they develop complications. For example, they can't see properly, they go and see the eye doctor and they say, oh, do you have diabetes? Say, no, I don't have diabetes. Say, go and check your blood sugar. That's when they discover that blood sugar has been high for years. So, but if that person was doing yearly checks, would have picked it early and we start taking care of it so as to reduce the chance of complications coming up. So, health checks is very important. And there's what we call age-appropriate tests or checks. According to the age of the person, be it a man or a woman, there are certain tests that your doctors will recommend that you do at least yearly, some of them twice yearly, like the pap smear for women. You have to do that. So that's just example. I'm just giving examples to let us know that preventive care is key, because we always say prevention is better than trying to cure the disease.
All right, Doc, thank you so much. Let's look at the signs and symptoms of kidney disease. Let's take it one after the other, because some persons seem not to know when anything is going wrong with their body. We have this faith thing, and we have this, it's just something small, without knowing that that something small may turn out to be actually big. So what are the signs and symptoms? What should we look out for?
Now, I want to say that there are some people who develop kidney disease and they are completely asymptomatic. What I mean by that is that they don't know that anything is wrong. No symptoms. And then all of a sudden, they feel so ill, they go to the emergency room and they are told the kidneys have failed. But one other reason why such things occur is that we get symptoms and we ignore them. We explain it away. This is your usual job. You've been doing it for 6 years. You've been coping. All of a sudden, you feel too tired and you're unable to do your job. And then you keep explaining it away. Oh, maybe they're stressing me too much. Or maybe I'm having some psychological issues. Start explaining it away. Meanwhile, something is really going wrong.
It's going wrong.
So when we notice changes in our bodies, we should not explain them away. Just see a doctor. Take some tests to be sure that it is nothing before you relax. Now, back to the symptoms of kidney disease. Because the kidneys help us to excrete water. When it cannot excrete water, the water accumulates in the body and you see swelling. Swelling in the face.
Okay.
Swelling around the eyes, especially in the mornings.
Okay.
And for such people, around the eye will be swollen. They may not notice, especially if it's male, because maybe they don't look at the mirror so often. But if it's female, by the time you want to do makeup, you say, what's going on? My eyes are swollen. And then you see that as the day progresses, say by noon, the face now back to normal.
Back to normal.
That's one of the early signs. So the face, the feet too, recurrent leg swelling. Each time the leg gets swollen, each time. Some people start notice that their abdominal gas starts increasing. Why? Because fluid is also accumulating there. Now, frothiness of the urine. The urine foams a lot, as if you have poured beer into a glass. It can be that dramatic. So that is not normal. You know that your urine has not been that way before. Now you see that it's foaming so much and you ignore it and think, oh, there's nothing wrong. No, it's time to see a doctor. Blood in urine, pain in the flanks. The kidneys are, like we say, middle part of the tummy, the flanks.
Yes.
So having pain in the flanks indicate that something is wrong with the kidneys and you need to see your doctor. Now, blood pressure is high. Especially you see a young person, the measure the blood pressure is high. When you see hypertension in a young person, you must make sure it is not kidney disease, because when something goes on with the kidneys, usually the blood pressure will also go up. So, like I talk about kidney stones, some people may actually pass a stone in their urine. And they will feel that, I passed a stone. Then you think,
you feel it.
You see, they will hear it, hit in the toilet bowl.
This is
so sometimes it can happen like that. Pain. You see, pain while passing urine can be a sign of urinary tract infection. And if you don't treat it, you see, there will be ongoing damage in the kidneys. So by and large, I think those are the main, the usual symptoms.
Okay, you talked about somebody being born with just one kidney. How can that person function in life?
Okay, well, we can live with one kidney.
Okay,
we can live with one
it's
kidney.
very possible.
In fact, that is why, for those who have both kidneys damaged already, they now need like a kidney transplant, and you can take a kidney from someone who has 2 good kidneys, and then
just anybody or somebody who is blood related.
Well, it's usually better if it's a blood relative, because sometimes people can't get a blood relative. Sometimes you see friends helping out their friend. They don't want their friend to die, so they give a kidney. But usually they will test to make sure that the mismatch is not too much.
Okay.
So we can survive on one kidney. Some people are born with one kidney and they don't get to know about it until maybe for one reason or the other they have to do abdominal ultrasound and they see that, oh, you have one kidney.
One kidney.
Or if something goes wrong with that one kidney.
With that one kidney.
And while they're investigating, discover that, oh, you've always had one. Some people have 2, only one is functioning. You don't know. Something has damaged the other one all these years without their knowledge, and it is when they now have problem with the single one, or by chance they did the test, we say, this other kidney is so small that we doubt if it's functioning. They will run tests and see that it's only one kidney that person has been surviving on. Or we can survive on one kidney. Now, there are some kidney diseases that are genetic.
Okay.
Like polycystic kidney disease. As the person grows older, they begin to form cysts in the kidneys. It's not from anything they did, or any lifestyle, or hypertension, or diabetes. It's just that they were born with those kind of kidneys. But it manifests when as you get older. Yes.
So what should be done about such kidneys?
Okay, usually, well, you manage them. So that is the person that should be told, look, Even though you like alcohol, stay away from it. Even though you like to smoke, stay away from it. Usually, people with such condition, we have
Must have a
hypertension.
healthy lifestyle.
We say yes, healthy lifestyle. Treat the blood pressure. Make sure you take your medicines to keep it down, because if you don't keep it down, you will increase the rate at which it will destroy the kidney. So usually we manage them and see.
Okay,
how long the kidney
you
can
also
work for
talked
them.
about having kidneys not properly placed where they are supposed to be.
Okay. Yes.
So is one supposed to go through surgery to correct them, or you just
okay. No,
leave
no,
them
you
like
leave,
that?
No, you leave them.
Like
You
that?
leave them, yes,
It
you
won't
leave
create
them.
problems in future.
No, it won't. You see, the thing is that when I say abnormally located, usually we have them up there. Some people may have it lower.
Okay.
So if that person is aware that one kidney is lower and the kidney is functioning, you don't get in a fight, because you don't want anybody to give you a blow there.
Okay, the person should not get into a fight.
Don't get into a fight, because you don't want anybody to give you a blow there and damage your kidney.
And damage the
Because where
kidney.
they are high up, normally located, it has to be real intense
Before
they can get injured.
damaged.
But the one that is low and
Low.
superficial, kind of, can be easy. So that kind of person, of course, we know, no matter how provoked, don't get into a fight.
That's
Yeah.
crazy. All right, it's about time you started calling in now. 052-290573. Call. Ask any question that you want to ask. In as much as we are not talking outside the kidneys, just ask questions so that you will be educated. If you know the number of persons that are suffering from kidney problems, even as we speak, you would be forced to change your lifestyle. Now let's look at the issue of because we discovered that a lot of young men are coming down with kidney diseases. There are so many sport drinks out there. I don't know if that kind of drink have if it can affect the kidney. You see all sort of sport drinks, then you see some energy drinks, you see some funny names, you see some in small cans, and you begin to wonder. And then you see young men especially mixing like 3, 4, 5 in a glass cup, and then they say, it's like a cocktail of some sort, but they kind of enjoy it. And I'm worried about that, because I know a couple of persons who do that, So I'm really worried. Can that create problems?
Well, we usually advise to stay away from energy drinks, because I think there's some link to hypertension with the energy drinks. And like I said, nephrologists always advocate drinking water. So if you want to take something other than water, at least let it be a soft drink or something if you don't have diabetes.
Diabetes, okay.
So taking fruits, that would be better.
Is it
Than take those energy drinks, definitely. No.
Hello, caller. Good afternoon. Please tell us your name and ask your question.
Hello?
Hello, tell us your name and then ask your question.
Okay, I'm Osato by name.
Happy to have you on the program.
Question I want to ask is not among kidney. It's eye.
Eye.
I have typhoid. Hello? Hello?
Yes, I'm listening to you, Sato.
Okay, I have typhoid. So I've been treating it for close to a year now.
You have been
I've
treating
spent
typhoid
money
for close to
on
a year.
drugs and several other things. I don't know what doctor will say about my head.
How
That's why
did you
I
know
called.
that you have typhoid?
Yes.
How did you know that you have typhoid fever?
Ma?
How did you know that you have typhoid?
I went to test. I've done up to 20 tests. So I did another test. So that is typhoid test. So I have typhoid. So I've been treating it. It doesn't go. If I drink, it will come back. If I drink, it will come back.
Okay.
That's why I want to
Okay,
know. what
we're
doctor will
actually
tell me
talking about the kidney today, but Doc, can you help him out?
Okay. First of all, that test that people usually do to know whether they have typhoid or not does not confirm typhoid fever.
Okay.
So that test that you go and you do, they'll say, oh, it's significant. Go and take antibiotics.
Go and take antibiotics.
It is not a confirmatory test for typhoid.
Okay.
And typhoid is actually a serious infection.
Okay.
One cannot have typhoid and be walking around. It can cause fever, it cause abdominal pain. Some people will have diarrhea, some will have constipation.
Okay.
In those days when we didn't know much about typhoid. It killed people because it will cause perforation of the intestine. So typhoid is a serious infection.
Okay.
But these days, people tend to over-treat it. Once somebody has a fever, the
This
body is
is
hot. I mean, the
typhoid.
body is hot. They will go and treat. They will give them medicine for malaria, give them medicine for typhoid, like ab initio.
Okay.
But he's saying he has typhoid. I don't know
And he
if
has
he has
treated,
if he's
you know.
been having fever, that the body gets hot, and it's been happening like that. He should go and see a doctor for a proper check, for him to find out what is really going on.
Okay.
He can't, unless he's eating contaminated food and drinking contaminated
The
water.
water
Why
all
should he
the
continue
time.
to have typhoid?
All right, Osato, please see a doctor. 0522905573. Hello, caller. Good afternoon. Hello. Hello.
Hello.
Good afternoon.
Good afternoon, ma'am.
Can you speak up a bit, please, and reduce the audio level on your TV?
Hello.
Hello. Yeah.
Good afternoon, ma'am.
Good afternoon.
My name is Gota. I'm calling from Sapele Road, ma'am.
Okay.
Ma, I want to complain about my stomach. Because anytime stomach is so me, except if I lie down straight, that's the only when I can get myself. I don't know what's wrong.
Okay, you have issues with your stomach. You're afraid if your kidney is affected, innit?
Yes.
Okay, doc. Does kidney problem makes your stomach to pain, or do you have pains when you have kidney problems? Does it disturb when you sleep on one side or the other side? Does it disturb sleep position?
So like I said, if you have pain in the flanks up here,
Yes.
or pain while passing urine, you have to make sure that this problem is not from the kidney.
But not sleeping position.
Well, if you have one kidney on the left, disease or causing problem, lying on that side may cause pain.
But it's just that a lot of people like to call doctor on phone, call doctor on television, without actually going to the hospital first. I think we should at this point advise that if you have any pain at all, no matter how small, it's better you see a doctor. Let the doctor tell you that it's nothing, rather than confiding in your friend who will just help you to wish it away, or just help you to like, let's go to the back and pluck some leaves and do this and do that. We're not saying that leaves don't work, but see a doctor first before you start doing self-medication. Now, we've talked about sport drinks that is very bad for your health. Now, let's look at the issue of bleaching, because I know that also have adverse effects on the kidney, even though sometimes people don't believe that it can affect your kidneys. Even some other substance that we take,
No.
and more so that we have a lot of organic this, organic that, organic everything, and every female want to use that. Let's talk to the female now.
Now, talking about bleaching agents, you see, you have people who use creams, who use soaps, who use drugs, tablets, capsules
to bleach their skin.
To bleach the skin. And then one needs to be careful, because you don't know whether you are genetically predisposed to having kidney disease or not.
Okay.
Now, these bleaching agents, the active ingredients vary. Some are very toxic. For example, bleaching agents that contain mercury.
Okay.
Mercury is toxic. It will be absorbed into the blood to damage
Straight
kidney,
away.
to damage the nervous system. But it really bleaches the skin very well.
It does.
It does.
Okay.
But it is dangerous.
Dangerous.
Now, if you see someone using mercury-containing cosmetics, you are shining, but you don't know they already have a predisposition to hypertension, a predisposition to kidney disease. Now you go and use this, and in a few years, you're fighting for your life. Why? Your kidneys have failed. Now, even the organic products, they bleach the skin because they contain substances that can damage the... You see, it's the melanocytes in the skin that produce melanin is what is responsible for our skin color.
Skin color.
So black people have darker melanin. The white people also have melanin, but not as dark. And melanin protects us from skin cancer, from the effects of the sun.
Okay.
So when people go and destroy the cells that produce melanin, they now have they now have an increased chance of developing things like skin cancer as well, especially since we're exposed to this ultraviolet light rays from the sun. You know, the people abroad, they are not so much. In some areas abroad, they're not exposed to so much sun, except maybe during the summer. But here, we're exposed to a lot of sun.
Okay.
So that's why you
let
see
me
all
pause
those
you there and see if we
damage.
can pick this call. Hello, caller. Hello. Okay, I was hearing somebody's voice. Hello.
Hello.
Kindly reduce the audio level on your TV set, please. Okay, talk to us. What's your name?
Good afternoon.
Good afternoon.
Please, there's a question I want to ask.
Go ahead.
You see, somebody that have diabetes, they say the doctor says should be taking fruits. You know, fruit contains a lot of sugar, like pineapple, banana, and so is it advisable to be taking that kind of
You
food?
didn't hear the doctor right.
Is it not sugary? Is it not sugary enough?
Okay, you didn't hear the
I will
doctor
answer you.
right. Please answer. I know he didn't hear you
Now,
right.
yeah, but that's a good question because the best diet for everyone, whether you have diabetes or not, is a diet rich in vegetables and fruits. Now, the management of diabetes, number one is dietary management. If you like, take all the insulin you want to take all the oral medicines you want to take to control the sugar. You will not succeed unless you follow an appropriate diet. Now, for someone who has diabetes, he or she is allowed to take fruits and vegetables as well. But you have to be careful the kind of fruits you take. You are not allowed to take those fruits that are so sugary anyhow. You cannot sit down and only you will finish one big pawpaw. Or you just sit down, only you will eat 5 fingers of bananas. No, your blood sugar or pineapple, your blood sugar will go up. Now, part of the management of diabetes, you need to have a dietitian. And if you've been following up, going to the clinic, your doctor would have sent you to a dietitian who will advise you on the things to eat and the things not to eat, and the appropriate quantity to eat. For example, those who have diabetes, they can take garden egg as they like. They can take cucumber as they like, because we know that that is not going to raise the sugar. But you can't sit down and take 5 oranges or 5 fingers of banana. No. If you are to have banana, we say 1 a day, 1 finger a day. So you can take fruits and vegetables, but you have to be guided.
Okay. All right, so I hope that caller is happy. Hello, caller. Good afternoon.
Hello.
Good afternoon. Yes, good afternoon.
Good afternoon, ma.
Please tell us your...
Visit on our program just now.
Okay.
So, I want to talk about my senior sisters. They call me say she's a peace blood, so I'm not sure understand what to tell them. That's why they listen to the program this afternoon.
Okay, then tell you say your senior sister the peace blood.
Yes.
Okay. And you don't know what the TB. You not carry and go hospital yet.
No.
Una never carry and go hospital yet. Okay, make I leave doctor make he answer you now.
Okay. Okay. Now. Okay. Blood in the urine should never be ignored. It can be something as simple as is a stone that is trying to come out. But it can also be something as serious as a malignancy. So blood in the urine anytime should never be explained away. You should take her to see a doctor.
Okay. So I hope that madam don't hear. Carry that to your sister. Go see doctor now. Hello, caller. Good afternoon. Please tell us your name and where you're calling from. Hello. When you call, endeavor to speak up so that we'll hear what you're saying and reduce the audio level on your TV set. Hello, caller. Good afternoon. Please tell us your name and where you're calling from.
My name is Neda. I'm calling from the
Happy to have you on the program. Ask your question, please.
And I had a sense that the symptom of kidney whenever passing urine with pen. You understand my question?
No, I don't.
Okay. Whenever I pass urine, I pass it with pen. What does that mean?
Okay, with pain.
Yes.
Okay.
So it is possible that you have an infection. So you need to go see a doctor. We tell you what tests to run so that it can be treated.
Okay. Please go and see a doctor, not one chemist around your area, okay? Particularly where the chemist owner is not a pharmacist, nor is he or she a health worker. Go and see a doctor. Let the doctor prescribe for you. If you don't know where to go, go to UBTH or go to Central. Hello, caller. Hello? Hello? Please bring down the audio level on your TV set. Bring it down so that we can hear you. Hello? Okay, it's like you're not ready to talk to us yet. If you bring down the audio level on your TV set, we'll be able to hear you. Okay, Dr. Chite, what if somebody already has kidney problem? What is that person going to do? Okay, hello? Hello, good afternoon. Good afternoon.
Hello?
I'm not going to take your call because your audio level, the audio level on your TV set is too loud. Drop it. Drop the audio level and then we'll be able to talk well. Hello? Hello? All right, Doc, while we're waiting for more calls, what should a person already have do?
Okay, now.
Okay, this one is loud. Hello, caller. Good afternoon. Hello? Please, when you call, the rules are easy. Speak up. Reduce the audio level on your television set. And hello? Hello, good afternoon. Good afternoon. Who are we speaking to now?
My name is Frida.
Okay, Frida, go ahead.
My stomach aches.
Okay, how much?
Huh?
How much does it ache, your stomach?
Since last week.
Since last week. How old are you?
Yeah.
How old are you? How old are you, Frida?
I think it's typhoid.
Your stomach aches and you think it's typhoid.
Yeah.
Dr. Frida, you amaze me, girl. Go and see a doctor, please. Go to Central Hospital, go to UBTH, or go to any good hospital around your area. I wish I could just copy out your number now, Dr. Frida, so that, we'll see what we can do. Okay, that's aside. Talk to us. We're talking about the kidneys today, okay? We're talking about signs and symptoms. If you already have it, what to do. If you don't have it, what you should do, what you should avoid. You've heard Dr. Jite say, do not bleach your skin. Particularly when you use bleaching agents that has mercury and all of that. It's not good for you. Your body will absorb everything and your kidneys may just fail. You don't want to. Let me not just go there. So, hello, caller. Good afternoon. Please tell us your name and ask your question.
Good afternoon. My name is John Wokom.
Okay, John, go ahead.
Calling from Okada.
Okay, John, go ahead with your question.
There's a question I want to ask, please.
Okay.
When somebody have an pie, what do we do?
If somebody has what?
Pie.
Pie.
Yeah.
John, wow, now kidney will be the talk about today. Okay, it's all right. People will call in. Doc, can you help?
Okay.
Can you help John?
Yes, you need to see a doctor.
Okay. So
And
John,
then you need to see a doctor, and one of the things that make pies worse is when you pass hard stools.
okay.
You have to make sure that you stop eating stuff that will cause constipation or make your stools hard.
And drink a lot
things
of
like
water.
And drinking a lot of water, like taking a lot of bread and biscuits. All those things constipate. So he needs to adjust the diet too. But he needs to see a doctor because it depends on the grade.
Okay.
So based on the grade, they may decide to do surgery to take care of it, or can still give him some medication to help adjust the diet.
Okay.
So basically, he needs to see a doctor.
Okay.
And it's best to do that because it can become an emergency sometimes.
Okay, so John, I hope you got that right. All right, we're talking about somebody who is already down with kidney disease. What's that supposed? How that person supposed to do? You know, both kidneys.
So we said people should have health checks. Sometimes when people go for health check, they discover, oh, something is going wrong with the kidneys. We now try to tackle it. Now what we do, once we are able to identify what is wrong with the kidneys, we now give treatment to delay the progression of the disease.
Okay, to delay it.
To delay it.
It's not as if it can be cured.
There are some that you cannot cure. For example,
okay, there are some that can be cured.
Yes, if the person has a urinary tract infection, for example,
Okay.
or pyelonephritis, infection in the kidney itself, if you
Okay.
treat it,
It
will go away.
Will go away.
Or somebody has stones,
Fantastic.
if the person starts taking enough water, and we're able to adjust the diet, once we know what is making the person form stones, then they won't form stones anymore and it won't cause damage.
Okay.
Or somebody has a enlarged prostate,
Okay.
which is blocking the urine flow. If you don't take care of the enlarged prostate, it will lead to kidney failure.
Okay.
So, but if you take care of it, then the kidneys
you'll be
can work
good.
well.
Okay.
So what that was, then those things that we know can damage the kidney, like hypertension and diabetes, we'll make
Should
sure
be
we treat
treated.
it. So someone has hypertension, please take your medicines. And I want to emphasize here that there's something our people do most of the time which is wrong. We know that we have digital BP machines around. We can measure our BPs at home. But people use it wrongly.
Okay.
You measure your BP, you have hypertension, you're on medication. When you measure your BP and it is normal, it doesn't mean stop the medication.
Okay.
It means the medication is keeping it normal. Continue it.
Continue with the
But
medication.
people, when they check the BP and they see that it is within normal, they stop
They
the
stop
drug.
the drugs.
And when you stop the drug, after some days, the blood pressure goes up again. But they may not even check the BP again until the next time they feel sick. Oh, I'm having headache. I don't feel well. Let me check my blood pressure. And they see it's very high. And they say, oh, the BP is high again. Let me take my medicine again. And they do this for years. Meanwhile, those periods where the BP is not controlled is damaging organs in the body. So they come down with complications. So please, our people need to learn how to take their medications properly. And then some people take their medications for years. They don't go for a checkup. They don't go for follow-up with their doctor. They stay away. One doctor prescribed medication for you 5 years ago. You've not gone back to see him. You've not seen any other doctor. You are just taking that one drug and you think it's okay. He may not be checking the BP. You will not know. There may be other things like cholesterol is high, you are not checking. Your kidney function, because you're not seeing the doctor, he's not checking. If you are seeing a doctor regularly, at least once in a year, he will check your kidney function, check the urine, to be sure that everything is going well. If there's any problem or the other, they begin to tackle it early. So there are people living with kidney disease, and they've been living with that kidney disease for 10, 15 years, and the kidney has not failed.
They are doing well.
They are just managing it, taking care of it. The person who has a kidney problem should avoid some group of painkillers. In fact, the person who has a kidney problem should avoid drugs that we say are toxic to the kidneys. They should be careful. So they can't take medication
but
anyhow.
how would they know that if they do not go to the hospital?
That is the problem. Because usually the doctor will say, stay away from this, don't self-medicate. You know your kidneys have issues. If you take a drug that is toxic to the kidney, it will lead you start needing dialysis. So that is the people have to be careful, because you can buy painkillers over the counter and people mix them.
Then you have problems. Okay, we're talking about those who are already down with it.
Yes. So we manage them. Take care of their blood pressure very well. Those that have diabetes, take care of, like some people have diabetes. We've known for 15 years that, oh, it's already affecting the kidney, but because of proper management, they have not moved on to kidney failure, now needing dialysis or kidney transplant. So those who have established kidney disease, even those who were born with defective kidney, those who have polycystic kidneys, once they make the diagnosis, they come for follow-up. Maybe once in 3 months, we'll make sure that their blood pressure is well controlled. If they have an infection, because we predispose them to infection in the kidney. When they have infection, you treat it.
And
So that is
they
how
will
we
live normal life.
We live normal life. There are many people living with hypertension and diabetes.
And
If they don't tell you,
doing
you will not
well.
know. And they're doing well.
Now let's look at mixing orthodox medicine with with traditional medicine when it comes to the issue of kidney problems. Because if you go, like I do a lot of research on the net, you find people advertising all sorts of herbs for kidney problem. If you take this one, it will cure this, it will cure that, it will cure that. Just one medicine will cure so many ailments. And you see people subscribing to it, buying online and all of that. And then others will just say, okay, somebody said if you use this, if you combine this leaf and that leaf and that leaf, you see that your kidneys will work fine. How true?
You see, the problem with herbs, a lot of our drugs these days started as herbs or the bark of a tree or
Back of the
something.
tree, yes.
And then they isolated the active ingredients in those drugs. Then they now discovered their chemical properties, and they were able to produce it.
Okay.
Now, when people mix herbs, you are not sure of the chemical ingredients. You don't know what the active ingredient is. You don't know whether you have some toxic substances in it, and that is the problem. You have one bottle, a mixture, and they say it will treat this and treat that. Some people will take them, the damaged kidney, damaged liver. Some people will take it, they will not have any problem. But the thing is, what is the active ingredient in that herb? Do you know it? And sometimes they don't have dosage. You just say, okay, just drink it, just drink it. Either you're drinking a bottle, you're drinking a cup, you're drinking it. You're not sure of dose. And that is different for orthodox medicine. They will say, take this dose, take this amount, and the drugs have been studied such that we know we know most of the side effects. So when they start manifesting, we can say, oh, the drug is causing this, let's do that. The drug is causing that, let's do that. But you can't say that for herbs. We know that before we started doing orthodox medicine, our people were using herbs, yes, and it does help some people. But we need to be careful. We need to be careful. More so, if you already have compromised kidneys, you need to be careful.
So you can't take orthodox and herbs together, because some persons do.
Usually we will not advise that. It's just like you are seeing an orthodox doctor, he prescribes something for you. He thinks this is what his drug is doing, but you are taking something else. You're going to cause confusion. By the time you come and you're having some kind of problems, you'll be wondering, is it my drug or what is happening? Not knowing that you are taking something by the side.
Okay.
So it is also not good to not let your doctor know that I'm taking this herb as well and all that. And sometimes these medicines are alcohol based. You ask somebody, do you take alcohol? You say no.
No.
But you are taking one herbal medicine every day and it is made with local gin. Are you not taking alcohol? You're even taking more than the person who takes a bottle of beer. So we have to be careful.
Hello, caller. Good afternoon. Hello. It's 052290573. The number will be on your screen. Hello. Hello. Now let's look at kidney problem in children, because I was surprised to know that children do suffer kidney problem too. How do we manage those children? How do you even diagnose it?
Now, children have special doctors for children. We call them pediatricians.
Okay.
Now, just as I said before, that some people are born with defective kidneys. Some children are born with a problem with the kidney that will manifest in childhood, even as babies, and you need to handle it. Children too can have infection of the kidneys, infection in the urinary tract. They can also have stones as well. So they are not exempted. No one is exempted. Anyone can. And even children have to. Some children have their kidneys, so their kidneys fail and they require transplantation. So some children actually get kidney transplants. So children are not exempted. So when children have kidney disease as well, we manage them just the way they are adults are treated. But they have their own special doctors for them.
Okay, I know of some persons that had a transplant. The person traveled several years ago, but came back, she was good, she was okay, but a few months after, maybe say 2 months later, she started manifesting some symptoms and went back to the hospital and was told that the body rejected the kidney transplant.
Okay.
I don't know why that should happen.
Okay, now.
Okay, let's do this call before that. Hello, caller, good afternoon. Hello? Hello, can you speak up a bit, please? Hello? Hello? Okay, we lost that call. Why do we have that kind of situation often a time?
Now, the way God created us, once anything foreign.
Hello? Good afternoon. Good afternoon. Okay.
Anything foreign, the body will reject, the body will destroy. Okay. We have antibodies, we have white blood cells, we have soldiers that help us to fight infection. They will also fight anything foreign in the body. So when you take one organ.
Okay, Doc, just hold on. Hello, caller, good afternoon.
Good afternoon, madam.
Please tell us your name and where you're calling from.
This is Sonny calling from Guinea Road.
Okay, Sonny, go ahead with your question.
I want to first of all congratulate you and thank you for this enlightening program.
Okay, thank you, Sonny.
And my question is this, man. After this party, traditional medicine. I don't know the dosage because somebody recommended that I should go and pluck one of these shower shop trees.
What's wrong with you, Sonny? Why did the person ask you to go and take shower shop? What are you suffering from?
My dad is a BP patient.
Your dad is a BP patient.
Yes.
Okay.
But since we started giving him his complaint of side, I don't know what to do, side of the stomach. So I don't really know how we should discontinue. Although my father said that the BP has dropped, when he tested the test has dropped. But he's complaining now, side kidney, I don't know.
What is he complaining about?
The side stomach.
The stomach.
Inside, he's feeling some pain.
In the stomach.
Yeah, so I don't know. I want to just advise me whether we should discontinue with that normal about this or to go for medical checkup. I don't know.
Okay, let doctor just answer you straight up.
Thank you.
You should go for a medical check. You have you are attributing the pain to the soursop water or whatever you gave him, but it's also possible that it is not. So it is good that you should take him to see a doctor so that he can be examined. Doctor will ask you more questions, examine him, and ask for tests if necessary. It's better that way. You are assuming that it is soursop water that is causing it, but it may not be. It could be, but it may not be.
Okay. All right, Sonny, hope we answered your question. Okay, Doc, let's continue with our discussion.
Like I was saying, that the body will reject anything foreign.
Yes.
So when you take one kidney from one person, we say is a donor, and give to the person whose both kidneys have failed, the body will reject it outright and destroy it. That's the normal thing. So anytime we want to give one person an organ from another person, you have to depress the person's immunity.
Okay.
They use injections, medications to depress the person's immunity before the surgery and for life after the surgery.
For life?
For life after the surgery. The group of persons that you will not find much rejection are those people we say monozygotic twins. That's those twins that look alike. Because their genetic makeup is close.
It's close.
But even then, they will still be given They will still be
Drugs.
giving some drugs to depress
To
their
depress their
immunity, but
immunity.
it will be little, it won't be much. So, to prevent rejection, before the surgery, they give immunosuppressing drugs, and afterwards, for life, the patient has to be on immunosuppressant drugs
For life.
for life.
Is it every surgery that is successful?
No, not every surgery is successful.
We need to know that too.
Not every
All
surgery.
right, Doc, we're about to go now, and I'm feeling so depressed all of a sudden that some of us can actually do this to ourselves with what you drink, with the kind of lifestyle that you're living, and those of us who are bleaching our skin. It will damage a lot of things in your body, not just your kidneys, okay? Some persons will say, I've been bleaching since and nothing has happened yet. And you know, you see them encouraging other people to do so. And you just talk about the drugs that they have to take. I don't know, can you just please tell us again what can happen? You know, let's just, you know, we started it at the beginning of the program. We mentioned all of this. As we're ending, Doc, please mention the things that we should do and the things that we should not do to save ourselves from kidney problems.
So, once again, to help our kidneys, let's drink enough water.
Enough water. Like how many liters a day? Somebody will want to know. Like how many bottles a day?
Okay, liters, 2 to 2.5.
2 to 2.5
5
daily.
liters you can take daily.
You know,
but for those who have kidneys,
there are persons who are naturally not interested in drinking water.
oh,
There are people
if they
like
don't,
that.
yes, there are some people like that. So to encourage them, usually we say, as long as the person is not diabetic, maybe put a little, sweeten it a little.
Okay.
Not that you will drink a full bottle of mineral, or
Okay.
sweeten it a little, or add some orange juice or something,
So it's
just to
like people
encourage
drink
them
water.
so that they can drink more water. So drink water. Drink water. Water is the best beverage. It helps our kidneys. And you will know whether you are drinking enough. Just look at your urine and the color of your urine. Now, when we have any symptom that is odd, let me not say only for the kidney, it is good for us to have a health check. Don't explain it away. It's best for you to even see the doctor. Let them say it's nothing, than for you to say, oh, it's nothing, and then later discover that it's one big thing.
One big thing.
Now, if you have hypertension, treat it. BP medicine should be taken daily.
Okay.
If you have diabetes, follow your diet and take your medication. And don't only do that and stay at home. Make sure you have follow-up care in the clinic.
Okay.
Now, for those who already have kidney problems, make sure that you follow up with your treatment. Be careful. Beware of those who will bring herbs to you and say they can cure this and cure that. You may just have something toxic in there.
All right, people. I hope you've learned so much today on the program. It's very important that we take care of our body, take care of everything that has to do with our body, not just your kidneys, okay? You might be trying to take care of your kidneys and then you're damaging your liver. You might be trying to take care of your liver and then you're damaging something else in your body. Let's learn to do medical checkup like every 6 months or every 1 year, depending on what your doctor says to you. Go to the hospital today, visit the doctor, let the doctor tell you that this or that is wrong with you or not wrong with you. Let's not behave like the doctor that called in today. Let me not mention her name again. I'm sure a lot of persons would have forgotten her name by now. So let's do our best possible to stay healthy and stay alive. Thank you, Dr. Jite.
Thank you for having me.
We'll see you again. All right, people, that's all for today. We'll see you again on Monday. But until then, your health is in your hands. Bye-bye.